Welcome to The Heart of Health Live. There's a place for modern medicine in your life. Learn to use it correctly by getting your toughest questions answered on today's broadcast. Discover modern medicine's strengths and weaknesses. Lifestyle medicine opens the door to optimum health and healing. How you live and what you eat can profoundly affect mind and body. Learn simple solutions to complex problems. God provides the ultimate healing we all desire. He wants us healthy and happy. We just need to understand His plan for our lives and live accordingly. And now, live from Studio 1A in Chattanooga, Tennessee, here's your Heart of Health host, Dr. James Marcum.
I want to welcome everyone this evening to Heart of Health Live, where you are the program. Our topic today is going to be cancer. Another name for that is oncology. And we have a specialist that works in the field, Dr. Frank Kimsey, and he is a radiation oncologist. And he's going to explain what that is, what he does every day, how he helps people. We also want to invite your questions about cancer, or specifically radiation cancer. We're going to talk about a modern device out there called a cyber knife that's helping many individuals. How might you get a hold of us? You can give us a call. Our phone number, 855-644-3278. Or now in this world of technology, you can also text us. A lot of people like to text. My teenager, Kelly, likes to text. My son, Jake, who's almost a teenager, they like to text me. And if you're a texter, you can give us a text at 423-834-7307. Well, we hear a lot about cancer in the news, and what I hear from people in the office and from questions that come into our website at heartwiseministries.org, a lot of people don't know where the truth is in oncology. There is a place for modern medicine. There's a place for, radiation and chemotherapy. There's a place for living a healthy lifestyle. There's a place for screening. There's a place for a healthy diet as well. And all of these modalities have to come together for the treatment of cancer. But one thing out there is cancer. A lot of people are scared when they hear the word cancer. And we're hoping by giving you more information tonight that if you might have cancer or know one that has cancer, you can minister to them and help through knowledge eliminate some of this fear. After the break, I'm going to introduce Dr. Frank Kimsey to you. He's volunteered to give his time. On Heart of Health Live, we don't sell a product, we don't push anything, we just want to give you good, solid information and answer your questions. So give us a call. Our phone number, once again, is 855-644-3278. We'll be right back.
The Heart of Health Live will return in just a moment.
The Heart of Health Live is brought to you by Heartwise Ministries.
Hello, I'm Dr. Tim Jennings with your Mental Health Minute. Have you been moody, tired all the time, or more forgetful than usual? How are you sleeping? There are 4 physical requirements to life: air, water, food, and sleep. Deprive yourself of any of these life requirements and your ability to function will suffer. Sleep deprivation alters normal brain function, impairing memory and attention, increasing irritability, and has been associated with increased risk of diabetes, obesity, and depression. Sleep deprivation impairs driving as severely as alcohol intoxication. Adults require 7.5 to 8 hours of sleep per night, adolescents 9 to 10, and children 11 to 12. If you're struggling to get enough sleep, avoid caffeine, establish a regular sleep routine, ensure your bedroom is conducive to sleep, and if these measures don't work, see your doctor. To be smart requires a healthy brain, so be smart, don't stress, and get regular rest.
To learn more about mental health, visit tmschattanooga.com.
Heartwise Ministries and these adorable sheep want to remind you that every Thursday at 6 p.m. Eastern, the Heart of Health Live is all new with an exciting guest. That's 6 p.m. right here on this station.
Could it be this simple changed my life? What an amazing and solid yet fulfilling and liberating message Dr. Jennings provides. I loved it.
It is liberating. It frees your mind from all your mental turmoil and teaches you what is really going on.
This book is amazing and makes so much sense. It shows God as a God of love rather than an arbitrary, exacting God.
I am so grateful that a friend suggested I read Could It Be This Simple? It has helped me fine-tune my thinking. This book not only helps the mind to heal, but helps to liberate the emotions by bringing them into balance. You will be captivated with the case studies liberally sprinkled throughout this small, easy-to-read book. I dare you to read it.
Get your copy of Could It Be This Simple? A biblical model for healing the mind at Amazon.com or wherever books are sold.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back, and if you're channel surfing, I'm glad you've joined us. Stop here. No need to go back to the news, because we're going to talk about something that's really going to help you out this evening. We have Dr. Frank Kimsey, a radiation oncologist. He's here to answer your questions. If he can't answer your questions, I know he'll listen to you, and we'll let you know what we think about any given subject. And you give us a call, 855-644-3278. Dr. Kimsey, thank you for joining us.
Thanks for inviting me.
And it looks like you're smiling.
I am.
So then you must have had some time off this afternoon.
That's right. The day's almost done.
And you're telling me you have a guest all the way from England visiting you, so that must be fun.
Yep.
Now I'm just curious. You know, we're in Tennessee. Where do you take someone from England out to eat? Where would you take your friend out to eat?
Usually my mother's.
Okay, that's a good point. You wouldn't take her to Southern food? You're not going to any Southern places yet?
We have.
Well,
Last
good.
night was the first baseball game. So.
Oh, good. Well, Dr. Kimsey, what got you interested in medicine and radiation oncology? Walk us through sort of your life in a nutshell.
Well, I think probably the biggest reason that I'm into radiation oncology is my father.
Okay.
My father's from Ducktown, Polk County area up in the Appalachian Mountains. And my great-grandfather was the first doctor up in those mountains.
Wow.
And so I'm fourth generation in the medical field.
Okay.
My father practiced in Ducktown, Tennessee, and then came back to Chattanooga and became a radiologist. And I grew up as the youngest of four boys, sitting on his knee reading mammograms and helping him take care of cancer patients. So that segued into my career.
Okay, now I guess to be an oncologist you have to go to medical school, and then what training do you get after medical school?
We do 4 years of college, where I did a few other diverse things other than strictly pre-medical work, and then I went to medical school at University of Tennessee.
Okay.
And did a year or two of internal medicine there, and a little diagnostic radiology, a little research, and then went to University of Florida where I trained in radiation oncology.
And what made you, there's so many different paths you could have gone, what moved you towards radiation oncology?
I think that I'm probably in the best medical field in the world, no offense to you as a cardiologist, but I get to spend a tremendous amount of time with my patients. I see a limited number of patients a year. I get to know them very well. Usually they're being seen during a crisis in their life, and you develop a really deep connection with your patient at the onset of radiation treatment and then for aftercare, which I'll typically see patients for years after we've treated them for their cancer.
Wow, so for you that relationship is sort of one of the things, because I hear that radiation oncologists are very good in the science field called physics. Is that true?
Well, we like to think that we are.
Okay.
I think it's important to understand the physics.
Okay.
A lot of the computer technology has been made a tremendous difference in our field, because radiation traditionally has been thought of being damaging to normal organs. And the wonderful technology that we have adopted in our field has helped us create less damage as we treat cancers with our tool.
Yeah, well, that's wonderful.
Yeah.
So we're here with Dr. Frank Kimsey. You can give us a call, 855-644-3278. We'd be happy to answer your questions. And Dr. Kimsey, we know that you work with this device called a cyber knife. That's modern medicine at the height.
Sure.
Describe what a cyber knife is, and I think we actually even we have a few pictures we can show of what it looks like.
It's a great name, and it really describes the technology very well. It was developed by a neurosurgeon, actually, by the name of Dr. John Adler at Stanford almost a decade ago. If you go to the Volkswagen plant and you see a car commercial where a car is going down the assembly line, and there are robots in the plant that are doing precision welds on that car as it goes down the line. Well, John Adler took the same robot and he miniaturized a radiation treatment unit. And it's actually the same robot that they use at the Volkswagen plant.
Okay.
They have about 260 of them, and we have one.
Okay.
But it's the same robot. And as a tumor sits in the middle of the patient, this robot is able to treat that tumor from over 200 different directions. Not only is able to treat from so many different directions, it uses sort of an algorithm very similar to our military would use for tracking missiles.
Okay.
That it's actually able to see a tumor in the body by doing x-rays every 15 seconds. And as the tumor moves, the robot's able to move with the tumor. So if you walk in the room and we're treating a lung cancer, not only is the robot moving from 200 different directions delivering treatment, it's actually moving as the patient breathes. So you can walk in the room and the robot's actually breathing with the patient.
Wow. Now, when you say treatment, what does that mean? Is it like radiation or?
Traditional radiation that we've used in my field has been given over a course of treatment. So a patient may come in for as much as 2 to 9 weeks of treatment where we're directing radiation onto a tumor and the surrounding tissues. The reason we've had to do it over such a long period of time, a little bit at a time during radiation, is because of the potential damage that can be caused to the normal tissues. This treatment is so accurate to a tumor that we can deliver the radiation in what we call ablative doses. So it's the knife component of the CyberKnife. It's very similar to being able to cut a tumor out, but in a non-invasive fashion. We don't have to cut the skin. We don't have to go in the center of the body. We have a very focal radiation beam that's killing the tumor right in the middle of the body.
Wow, that's amazing. Now, what type of tumors is this very effective at? I'm sure there's certain types that it's really good at and some might not be so good at.
We've had our program operating for almost 2.5 years now at Erlanger. We have a very large, what we call stereotactic program that primarily we've used this technology over the past decade by treating brain tumors.
Okay.
But we were only limited by treatment of brain tumors. We had to have the neurosurgeon actually place a halo and screw it into the scalp and bones of the skull. We had to attach a patient to a table. We really only got one shot at it with a regular radiation treatment machine. When we decided to upgrade our technology, we were able to segue to the CyberKnife very well that allowed us not only to still treat brain tumor patients, but also to treat other tumors in the body in a similar fashion, in a non-invasive, what we call a non-frameless method of treatment.
For instance, bone mets, would this treat something like that?
We've been real surprised. We've already had a very active brain tumor program. Patients that would normally have required treatment of the entire brain with radiation, we're able to focus the radiation on 1 to 3 tumors and treat those. But we've been very surprised. We've seen most of our patients with the development of our program for stage 1 lung cancer patients, early stage lung cancer patients, that the surgeons aren't able to operate on them because their lung function, their lung capacity is too poor for them to be able to take part of that lung out. And we can treat that with a CyberKnife. So these are people that would have been turned away that wouldn't have good treatment options for their lung cancer, and now we can offer them a potential cure with the CyberKnife.
Well, you know, I was thinking more of, palliation, how cancer sometimes you can't cure it, but it's causing pain, in a bone or spine, you can sort of help with those type of things.
We're still using mostly traditional radiation therapy for treatment of bone cancer or bone metastasis. Because the technology can be expensive. It also, sometimes giving treatment over a period of time can be more forgiving if we're having to treat a larger area rather than a very focal area. We have seen patients that have already had traditional radiation, and that's also been a large part of our program. They've had radiation and they've been told they can't have any more radiation. If we can see a tumor and it's small enough that has recurred where they've had prior radiation, we can use a CyberKnife. So they have an option that they wouldn't have had before.
Well, we have callers coming in. If you want to join the discussion, we're talking with radiation oncologist Dr. Frank Kimsey. Our number 855-644-3278, or you can text us at 423-834-7307. Christina, we're going to be back answering your question. Dr. Kimsey is going to speak with you right after this break, so stay with us. You're watching Heart of Health Live.
The Heart of Health Live will return in just a moment.
Heartwise Ministries, and these adorable sheep want to remind you that every Thursday at 6 p.m. Eastern, the Heart of Health Live is all new with an exciting guest. That's 6 p.m. right here on this station.
Heartwise Ministries would like to invite you to take a moment and connect with us and share your thoughts and comments. You can join the conversation on Facebook. You can follow us on Twitter. HeartwiseMinistries.org will help you stay up to date with what's going on. And of course, you can always watch past shows on Vimeo.com. I'd like to think that one day, when we get to heaven, we're going to see a list of people. People like Jared and Susan, who were introduced to Jesus because of something we said. Or maybe it was as simple as a passing smile. But these people will look into their past and be able to say, I'm here because of you. Recently, you may have heard that Heartwise Ministries has begun spreading the gospel to the young, the old, the sick, and the healthy using this very television program. But we need your help. We want to take this type of medical programming to the non-believer and the person who has closed themselves off to traditional forms of outreach. If you believe as we do and want to support Heartwise so that together we can count more names on the Tree of Life, please consider donating today at heartwiseministries.org. That's heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
In case you've just joined us, we're with radiation oncologist Dr. Frank Kimsey. And what he said that really impresses me so far, not so much the technology about the cyber knife, but he's able to spend time with patients and talk with them and have a relationship. And in this world that I see, relationships are just so valuable. Relationships with each other, there's healing in that. Relationships and understanding what's going on with the treatment to help calm down fears.
Sure.
And on Heart of Health Live, we also like to encourage that relationship you might have with God, who can help heal you permanently. And we want that to be a part of every treatment plan. Christina from California, you're on with Dr. Kimsey. Go ahead with your question, Christina.
Hi, I have an 8-year-old daughter. Her name is Daphne, and her heart beats in both chambers. And it beats 700 times more in a 24-hour period than it should be beating. Should I seek second opinion? I have her going to a specialist at UCSF, but I just worry about it.
You know, I think I'm going to handle this one.
I think that sounds like a question for you.
Christina, a couple questions. How old is your child? You said 8?
Yeah.
And I guess they found out about the extra beats with the Holter monitor. Is that correct?
Correct, yes.
Okay. Is the child having any symptoms? Are they passing out or feeling bad?
When she sleeps, it seems to me like her heart stops, but if you move her in a certain different way, like she'll move around and she'll start breathing again.
Okay. I would definitely go see a specialist, a pediatric cardiologist, and get their opinion on what these beats might mean. They'll probably do some more testing to look at the strength of the heart. They'll want to look for other things. Sometimes you can have abnormal circuits in the heart, and sort of the sooner you know, the better. If the child is passing out, has no energy, gets dizzy a lot, I would put this on a higher priority than if they're feeling well. So I think I would go see a pediatric cardiologist and just get their opinion on what these beats might mean. Okay?
Okay.
Thanks for your
All
call.
right, thank you so much.
Dr. Kimsey, that wasn't a radiation oncologist call, but this next call, we have Beth Ann from Michigan. Beth Ann, what's your question for Dr. Kimsey?
I have a question about my sister. She has a spot in her right lung.
Okay.
She was diagnosed with cancer. She did 9 weeks of radiation. We went back for the x-ray. They said it looked the same. She goes back next month for her CAT scan. And if it's the same, nothing has changed, then they're talking about chemo. But I was wondering, would this work instead of chemo treatment?
Well, Beth Ann, I think I understand the problem your sister's having, and sometimes no treatment's okay treatment. If she's not had a particular change in cancer therapy, sometimes no change means that the growth of the cancer has been arrested, and you may see something abnormal on a scan, but it may mean that it's dead tissue or tissue that's at rest and not a growing cancer at all. So sometimes no treatment may be the best option. I'm often asked to see patients that may have a failure of traditional radiation or chemotherapy, and then we can utilize this technology. But it may be a little premature for her yet.
Okay. Anything else? Yeah.
When we first started out, one doctor said the doctor that did the biopsy told us she didn't have cancer. Then she said they seen cancer cells, 5 cancer cells when they washed the lung or something. But another doctor thought it was just scar tissue or some infection.
Sometimes diagnosis of cancers can be elusive, and a lot of times we're trying to stick a catheter or a needle in a tumor and sample some cells, and sometimes we just don't get into the tumor where we see the active cancer. That's what we call a non-diagnostic biopsy. But if you see an abnormality there, then we as oncologists want to pursue that. We want to find out why we're seeing this abnormality. So a lot of times another biopsy confirms what our suspicions were rather than the first biopsy.
But Beth Ann, I have a question. Did your loved one smoke cigarettes in her lifetime?
She did. She has COPD.
Okay, and has she quit smoking?
Yeah, she's quit smoking now for 9 months.
Yeah. Now, Dr. Kimsey, I tend to be a little bit more aggressive in someone that has a risk factor like smoking.
Absolutely.
Yeah.
Absolutely. The number one risk factor for lung cancer is still smoking.
Yeah.
It's true what it says on the pack of cigarettes.
Okay.
And I think for a patient to be a good participant in their health care and their cancer treatment, that I do everything I can to encourage them to stop that lifestyle or social habit that's kind of gotten them into that position. And I think it helps them have a better outcome in their cancer therapy.
Yeah. And Beth Ann, I am so glad that you called and you're helping your loved one out, because it takes a full family of support and people caring about each other to help us overcome these illnesses. So we really appreciate you calling this evening, okay?
Thank you very much.
Thank you.
You know, that brings us up, we do on part of our website, Dr. Kimsey, we have a prayer team. So if anyone might have a prayer, just drop us a line at heartwiseministries.org. You spoke earlier about relationships, and a person comes in for the first time. How do you start generating a rapport in someone that's, I'm sure, already a little bit on the scare side? I mean, how do you connect with somebody? Because, in this world, it seems so sterile sometimes.
The way I try to connect to people is the way I talk to anybody else in the room. I want to find out about my patient before I even talk to them about their cancer, about their problem that they're there for. I like to spend a little time getting to know who's in the room with them. What do they perceive their problem is? Where are they from? What kind of work did they do in their life? Who are their family members? Sort of what makes them who they are before we even begin talking about how to tackle this difficult problem that they've come in with.
Yeah, and I found out in any type of disease, knowing what their belief system is important.
Absolutely.
Knowing what they think about things. Do you ever bring up spiritual things if they do, or do you sort of wait on that?
I think they usually bring it up when they need to, and we welcome that.
Good. That's good to hear. Now, what is the youngest patient you've ever treated?
Oh gosh, I remember a little girl I treated at 2 years of age with a brain tumor.
2 years with brain tumor.
Yeah, just a delightful young lady, and we had an extremely difficult time getting them positioned for radiation treatments.
Yeah, I imagine so.
But we had some really nice workarounds.
Okay.
Yeah.
And what is the oldest patient you can remember treating?
98.
98 years old. Okay, so that's good that you can remember those.
Yep, absolutely.
So you guys can work with just people from all sorts of age groups and all sorts of things. But it's exciting to see new technology in the place to use it. We've had a couple questions that come in about screening for cancers, and we're going to make sure we talk about screening on this, but we want to let everyone know that you can give us a call, 855-644-3278. You can text us at 423-834-7307. Nowadays in the social media world, a lot of people join us on Facebook, and you can join us on Facebook, be one of our Facebook friends, be part of the Heartwise family. If you want to watch this program again, you can go to our website. Nick Evanson, our communications director, will have this posted shortly for you to watch again if you missed something, because Dr. Kimsey is going to share some great insights with us. After this break, we're going to go to Pauline. She has a question for Marilyn. So Pauline, stay with us, and we're going to talk a little bit as we go on about things that each one of us can do to make sure that we don't pick up cancer at an early age, different screening tests we might do, and who might be in the high-risk groups and the low-risk groups. So stay with us. We're glad you joined us on Heart of Health Live. Dr. Kimsey's with us. He's not selling a product. He's just giving good information. He's doing this out of the goodness of his heart. Stay with us. Pauline, we're going to be back with your question after this short break. So stay with us.
The Heart of Health Live will return in just a moment.
There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance. When to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing? I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org. Hi, I'm Dr. James Marcum, speaker, director of Heartwise Ministries. And at Heartwise, our goal is to bring people into a relationship with the Heavenly Father using modern medicine and the healing principles found in the Bible. We teach people that there is a place for modern medicine and a healthy lifestyle, but it is in a relationship with their Creator where ultimate healing can occur. Over the past years, our ability to share this message of truth, love, and healing around the world has increased exponentially. But to continue this steady growth, we need your help. We are looking and praying for 100 individuals willing to give $1,000 a year. If the Spirit is moving you to become one of the Heartwise 100, won't you consider donating online today at heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Our guest this evening on Heart of Health Live is Dr. Frank Kimsey. He's a radiation oncologist. We've been answering questions, and if one person has a question, many others might also have a similar question. The last segment, we talked a little bit about someone that had a lung nodule that was getting treatment. Now we're going to Pauline in Maryland. You're on with Dr. Kimsey. Go ahead, Pauline.
Hi, Dr. Kimsey. How are you?
Hi, Pauline. I'm great.
I was just watching your program. I had a hysterectomy, which I had removed my uterus for fibroids.
Yes?
At the end of the surgery, about 2 weeks after, my doctor called and said he had something to talk to me about. When I went in, he said he found a tumor inside of the fibroids. Remember, he had removed the old uterus.
Yes.
So, after I did that, I went and had my test. I went and did my CT scan because he said it was a weird cancer. It was cancerous and it's weird. It's sarcoma. I said to him, okay, go ahead and do the CT. I went and did the CT, but after when I came back for the results, he said he hadn't seen the result, hadn't shown him nothing, which it wasn't done microscopically. So, he said if I wanted to do chemo, yes or no. But what I was asking, he said he hasn't seen nothing. I didn't know if he caught it when they did the surgery. And why would I do chemo?
Well, that's a very good question. A lot of times, I think a good way to describe a cancer when a patient has had surgery, it sounds like your surgeon has removed all the cancer. Think of it as sort of a weed in a field, and that weed's been pulled, but sometimes that weed can go to seed, and those seeds can spread on the wind throughout the whole field. Chemotherapy is a way to eradicate those seeds that may have spread by the wind on the field. Sometimes with uterine sarcomas, I'm asked to treat a patient right where the weed has been pulled to sort of get the roots where the weed has been pulled out of the ground. And with uterine sarcomas, sometimes a combination of both is utilized. It means that you're cancer-free, but what the chemotherapy and radiation purpose is to try to keep that going. And we use it oftentimes in that fashion.
Okay.
Yeah.
Well, Pauline, I hope that gives you a little insight. We want to thank you for calling us. Appreciate it, Pauline. Ketty, you're on with Dr. Kimsey. Ketty from Alabama, go ahead.
Hi, Dr. Kimsey, and thank you, Dr. Marcum, for this program. I praise God for this program. There's room for modern medicine, you know. My question is, my mother passed last year.
I'm sorry.
She was diagnosed with colon cancer, and we weren't expecting this. She was 88 years old, and at the time, they said that it was a stage 3. So we decided to have surgery. Now, when they tested the cancer, they realized it was a stage 4, and it had already metastasized to the lungs. Now, the reason I'm asking this question is because oftentimes we hear, chemotherapy, and radiation, it destroys healthy cells. Now, Dr. Kimsey, at what point, at what stage would a cancer be for you to treat or not treat? At what age would you treat or not treat?
That's a very difficult question. It depends a lot on what stage the cancer is. I think the first step when I see a new cancer patient is I try to determine, is my goal to try to cure the cancer, or is my goal just to provide palliation or comfort measures? Radiation is utilized often just for people that have incurable cancers but have bone pain or they're bleeding, and to try to help them with this passage to be more comfortable. It's really a balance of quality of life when you're dealing with that situation. And that sounds like the situation that your mother was in, that they knew she had an incurable disease. Well, what can we do to make her quality of life as good as it can be for whatever remaining time that was? Right. And that's probably why they may have discussed chemotherapy with you.
Okay, Ketty, did that answer your question?
Yes, it did. Do I have time for a second question?
Well, no, I'm afraid not, Ketty, but a couple things Ketty, don't hang up yet.
Thank you so much.
Ketty, and one thing I want to tell Ketty is make sure she has a family history of colon cancer.
Right.
So everyone with a family history of colon and everyone above age 50, it's recommended to get some screening tests because colon cancer is a cancer that if it's detected early, we can do a lot to help people. It's better to do that than to have it spread on. So we want to thank you for your call, Ketty. Brenda, you're on with Dr. Kimsey. Brenda from Florida. Go ahead, Brenda.
Thank you for having me on, Doctor.
Okay.
My question is, I have 3 sisters that has breast cancer, and this last one, they're fixing to have surgery in 2 more weeks to remove her breast. And I was wondering if it's not possible, maybe she doesn't have to have radiation or chemo after the breast has been removed.
And your question is whether she may or may not need to have additional treatment?
Yes.
Okay. A lot of that is determined up front when we do the staging on a patient with a new cancer. We're trying to determine whether they have a small tumor that's confined or a small tumor that may have spread or a tumor that has metastasized, but it's also in large part determined at the time of her surgery. So we never know until after they've had the cancer removed which category she may be in, that she may have a benefit with chemotherapy or may have a benefit with radiation.
And the tumor types.
And the tumor types.
Yeah.
How old are you, Brenda?
It's my sister. She's 77.
77.
Okay.
I know you said you had 3 sisters with breast cancer. We're really learning a lot more about breast cancer and genetics. And most breast cancers that we see that are genetically related are usually in a young population, usually below the age of 50, but not always. So I think it's really, really important to be conscious of your family history to make sure, again, that you're screening so that your cancer can be detected early at a much more treatable stage.
Yeah, and Brenda, there's, of course, there's mammograms and there's self-breast exam, but nowadays they even have this genetic testing that you can go to, especially for the younger.
That's
a lot
correct.
of people are getting tested at a young age and seeing if they have the gene for breast cancer.
Right.
So, Brenda, sometimes these questions are so unique because everyone has a different story, but I think that as they talk to their oncologist, they'll help walk her through these and talk about the risk and benefits of every different treatment. So we want to thank you for your call, Brenda. Appreciate it. Dr. Kimsey, that brings us up to risk and benefits. I think it's important for, everything has, hopefully everything that we offer has some benefits, but there's also risks to everything we do.
Absolutely.
What are some of the risks of radiation and the cyberknife? What are some of the risks of that?
We almost have to talk about 2 different camps. Radiation therapy that we deliver externally over a course of therapy over weeks, we do have to treat some of the normal tissues, and we cause a radiation irritation, or some people call it a burn inside the body. Now we expect most people to heal from that, but oftentimes people, when that heals, develop scar tissue.
Right.
And that can lead to radiation complications long term. That's why I think it's important when I treat a patient that I continue following that patient, not just months after they've completed therapy, but for years after they've completed therapy.
That's good. Remember, it's risk benefits. Talk to your doctor. You want to have complete knowledge. I'm Warren. Stay on. After this break, we're going to be back with your question with Dr. Kimsey. You're watching Heart of Health Live. Our number 844-644-3278.
The Heart of Health Live will return in just a moment.
Heartwise Ministries would like to invite you to take a moment and connect with us and share your thoughts and comments. You can join the conversation on Facebook. You can follow us on Twitter. heartwiseministries.org will help you stay up to date with what's going on. And of course, you can always watch past shows on Vimeo.com. I'd like to think that one day, when we get to heaven, we're going to see a list of people like Jared and Susan, who were introduced to Jesus because of something we said. Or maybe it was as simple as a passing smile. But these people will look into their past and be able to say, I'm here because of you. Recently, you may have heard that Heartwise Ministries has begun spreading the gospel to the young, the old, the sick, and the healthy using this very television program. But we need your help. We want to take this type of medical programming to the non-believer and the person who has closed themselves off to traditional forms of outreach. If you believe as we do and want to support Heartwise so that together we can count more names on the tree of life, please consider donating today at heartwiseministries.org. That's heartwiseministries.org.
Heartwise Ministries and these adorable sheep want to remind you that every Thursday at 6 p.m. Eastern, the Heart of Health Live is all new with an exciting guest. That's 6 p.m. right here on this station.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Thanks for joining us. We're talking with radiation oncologist Dr. Frank Kimsey, and he's been answering questions not only about radiation, but he's well versed in all oncology. And I can tell by the way he's been interacting with you today, he really knows how to relate to patients. And I think that relationship is just so important. You know, a lot of people go out of the doctor's office and they're scared to death. And when you're scared to death, the body makes adrenaline, cortisol, inflammatory markers. You know, you don't eat well, you don't feel like doing anything. Just letting someone know what's going on, answering their questions. I think that's part of the treatment, and there's real chemistry with that. Mm-hmm. So I'm glad you do that. Warren from Alaska, you're on with Dr. Kimsey. Go ahead, Warren.
Yeah, thank you, doctor, for taking call, but I just recently been diagnosed with cancer, and they said I have some on my lung, and they said that there's a mass of one form or another on my spine, and I'm on a lot of pain pills because of the mass in my spine. I'm at guess anyway, but anyway, I'm just scared to death. Like what you just got through saying, when they out of the doctor's office, you get just scared, and that's pretty much where I'm at. I am a Christian, and I do rely on God, you know. But this is just really, really scary, and I don't know what to. So I was supposed to have a PET scan yesterday, and a machine broke down somehow, and now I'm rescheduled for Monday. But I just really do not know what to expect from a treatment process and everything. I was just hoping that you could kind of give me a clues.
Well, Warren from Alaska, I think the first step is to not let the cancer take control of you. Mm-hmm. That you're in control of the cancer, and you need to know that in your mind, and so that you're able to tackle this problem. What the doctors are doing right now, they're trying to find out what the exact problem is. They're trying to find out what they're going to be able to do to help you. So while you're in this phase of testing, it's going to be a very big phase of anxiety for yourself, and you just need to understand that there is hope and that there are going to be some treatment options for you. They just need to know what those treatment options are. But you need to take control of this situation and not let the cancer take control of it.
Dr. Kimsey, what's a PET CT scan and how does this fit into everything?
PET CT is a really wonderful imaging tool for cancer because it not only shows us a cancer like a CT scan, we can see where a tumor is in the body, but it's a total body scan where a radioactive sugar molecule is sent into the body and it attaches to the cancer because cancers use a lot of energy to grow.
Right.
So it's able to light up areas of tumor that we may not have otherwise recognized.
Okay, so this will help Warren know where it's active and where it's not active.
That's exactly right.
Good. And Warren, thank you for calling. And our ministry wants to be a support to you. And if you go to our website, heartwiseministries.org, we have people that will call you and pray for you. We also be happy to continue to answer your questions. And remember that this is a journey that you're going through, and it's a learning journey, and that we know that in a relationship with God that can bring peace and ultimate healing. But along the way, there's lots. Sometimes God heals through modern medicine. Sometimes He heals through lifestyle. But that relationship will help give you peace. So at Heartwise, if we can help you, please join us on our website. And we want to let you know that we're going to be praying for you, especially that you find that peace. And I think part of it is started right today, is getting some answers, letting people know that you're not alone in this. There's people that will help you and talk to you. So thank you for calling, Warren. We're going to keep you in our prayers. Okay. Next up, we have Rose, and Rose is calling from Tennessee. Rose, you're on with Dr. Kimsey. Go ahead, Rose.
Good evening, gentlemen.
Good evening.
Excuse me. I have a kind of a two-part question. In my family, on my dad's side of the family, when a lot of my male relatives turned 50, they went in for their colonoscopy, and they found out they had colon cancer. Now, I'm 60, and I've never had one because of the fact is that I have multiple sclerosis, and the medication that they give you, it says, because it's high in sodium, it tells you not to take this or administer this to a patient if they've got multiple sclerosis. So what can someone do? That's part one. And part two, a year ago, I got punched 3 times in my breast by someone, really, really bad, and still to this day, it hurts in those 3 spots. I do my breast exam, as I'm supposed to and everything, and is there something that I need to tell my doctor or when I go in for a yearly mammogram or anything like that, and could something hurt if it's cancer like in the breast?
So let me understand, your first question is whether you're able to undergo a colonoscopy because of medication that you're on?
No, because of the medication that they give you for a colonoscopy.
It interacts
with your multiple sclerosis.
Yeah.
Your family doctor or your gastroenterologist that you're seeing could probably advise you on that regard. Even if you're unable to undergo a colonoscopy, there are other methods for screening your colon that may be available, such as testing your stool for blood is an option. Sometimes CT colonography is available in communities. It's a non-invasive way to be able to evaluate your colon. So you may need to talk to your gastroenterologist about that and explain about your multiple sclerosis and the medicine that you're on for that.
Now she also was concerned about being hit in the breast and having pain.
Very good point. Mammograms are a great screening tool, but that's exactly what they are. They're a screening tool. About 8% of breast cancers won't show up on a mammogram. If you feel a lump in your breast, even though you have a negative mammogram, you may need to have some additional studies such as an ultrasound to evaluate that lump that may not show up as a cancer on a mammogram. If you've had anything that you felt in your breast that you're concerned about, bring it to your doctor's attention. When you have the mammogram, bring it to the technologist's attention that does the mammogram, and they can put a marker over that area to better identify the problem. And I encourage you to pursue that.
Yeah. So Rose, most times your doctors can find some way to screen for colon cancer, so ask them about the alternatives. And sometimes they can do the colonoscopy with less sedation too. That's always an option. And then if you find anything familiar, get it looked into, ultrasound, a biopsy, because mammograms, I think that's a great point. Mammograms aren't 100%.
That's right.
Yeah, and I get that a lot with stress tests. People think that they have a stress test, they can't have a heart attack. But remember, no test is 100% perfect that I know of, okay? We're going to have to go to break. We have some more calls after break. And Joanne, just hold on. After break, we're going to be talking to you. You're watching Heart of Health Live. Our phone number, 855-644-3278. We probably got time to squeeze in one call. But I'm sure Dr. Kimsey will come back again if we were really nice to him, come back another time. And we're going to save up more calls, because I can tell as the lines have lit up, Dr. Kimsey, this is something people are interested in. They want to know more about it. They want to get their questions answered. And I know we can't answer specifics, but we can talk in general, and hopefully this will allay some fears. You're watching Heart of Health Live. We want to encourage you to go to our website. That's heartwiseministries.org, where we'd be happy to answer your questions the best we can. We also have some very interesting articles. We have blogs. We also have things about relationships that might interest you. So stay with us. And Joanne and Janice, after this break, we're going to be back to answer your calls. Dr. Kimsey's going to stay with us. We just have a few more minutes on Heart of Health Live. Thanks for joining us. We'll be
The Heart of Health Live will return in just a moment.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
Medicines That Kill from cardiologist Dr. James Marcum is now available. In his newest book, Dr. Marcum explains why he believes that medications may very well be the #1 cause of death in America. Medicines That Kill uncovers the hidden risks associated with modern pharmaceuticals and outlines the biblical plan for physical and spiritual health. To find out how to get your copy, visit our website at heartwiseministries.org or call us toll-free at 855-644-3278.
Wow, these are really good.
You act surprised. Practice makes perfect.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who don't need perfection. They need you.
Hi, I'm Dr. James Marcum, speaker, director of Heartwise Ministries. And at Heartwise, our goal is to bring people into a relationship with the Heavenly Father using modern medicine and the healing principles found in the Bible. We teach people that there is a place for modern medicine and a healthy lifestyle, but it is in a relationship with their Creator where ultimate healing can occur. Over the past years, our ability to share this message of truth, love, and healing around the world has increased exponentially. But to continue this steady growth, we need your help. We are looking and praying for 100 individuals willing to give $1,000 a year. If the Spirit is moving you to become one of the Heartwise 100, won't you consider donating online today at heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
We've been talking with radiation oncologists this evening, and we've been answering a lot of different questions, and Dr. Kimsey's had a lot of background. We have time for about 2 more questions before we're finished. Janice, you're on with Dr. Kimsey. Go ahead, Janice.
Good afternoon, doctor.
Hey, Janice.
4 years ago, my sister was diagnosed with stage 4 breast cancer. They did not take off the breast, right? She had chemo and so for a while. Then after a time, the doctor said that the cancer has spread all over her body, and he has to give her chemo for life. Can you please shed some light because I've never heard about that.
That's a really good story that you're telling, because we're thinking of breast cancer with some of the new medications and chemotherapies that are on the market more as a chronic disease, that there are some breast cancers that they just keep responding for years and years to different treatments. And so we're kind of thinking of breast cancer in a different way as we've developed more medicines to be able to treat it.
Like a chronic disease,
That's
and
right.
even though you might not be able to cure it, you might be able to certain tumors slow it down.
That's correct.
So and maybe that's what they're trying to do, Janice, and it's all about the risk. Some people tolerate chemo very well.
Right.
That's very good. Well, thank you for your question, Janice. Sorry we got to move so quick, but we're going to go on to Joanne. Joanne from Pennsylvania, you're on with Dr. Kimsey. Go ahead.
Yes, I just have a friend who has lung, breast, and now metastasis to the brain of cancer. She's been having radiation and chemotherapy. And my question is, how can I encourage and support her through this time? I've prayed for her, prayed with them, she and her husband, but it's a very difficult time, and it's just something I was just wondering if you could shed some more light.
Yeah. I think that you're already doing it. Being her friend and her companion, her advisor, and somebody that she can pray and spend time with is really what everybody wants.
Yeah, and one of the things I like to add to that, Joanne, is the ministry of presence.
Mm-hmm.
You know, sometimes you don't have to say anything, sometimes you don't have to do anything. Just being there is a ministry in and of itself. And I'm just so glad that she has a friend. You know, a lot of people go through cancer all alone and they don't have friends and families to support and pray for them. And you know, I was talking to a cancer patient not too long ago, Dr. Kimsey, and they had esophageal cancer, which is very malignant, and they were in their younger years, and it had spread everywhere in their body, and they wanted to know why the chemo didn't work and why they weren't being healed, okay? And in the discussion of the conversation, it was realized that, you know, it's not everything's fixable. And that might be, you know, you plan that God still used that cancer to inspire others. And just like you said earlier, they lived out all the time they had that relationship with God, so they would have ultimate healing at some point. And God, you never know, you know, what His plan is for an individual life. So Joanne, I want to thank you for doing that. Just be with her. And I think as you pray, God's going to sort of lead you into the next step in that relationship. And speaking of relationships, Dr. Kimsey, I'm glad we had a relationship with you, and you came on to help our people at Watch Heart Health Live. And hopefully you can come back again.
I'd love to.
Come back again and continue to help people that have these questions and concerns. You've been watching Heart Health Live. You can get a hold of us at our website. That's heartwiseministries.org. Please be one of our Facebook friends. We want to let you know that we're praying for you. Our prayer team is here for you if you need us. So just drop by our website and let us know. I'm Dr. James Marcum with Dr. Kimsey, wishing you the best of health in this year, and continue to pray for each other and care for each other. Develop that relationship with God, and hopefully you will have that peace that comes with this. Thanks for joining us this evening.